President Cyril Ramaphosa spokesperson Kusela Diko and Gauteng Health MEC Dr. Bandile Masuku will face the ANC's Integrity Committee in the coming days. It's in relation to a controversial PPE contract awarded to a company owned by Diko's husband, King Matzikane II. Diko Masuku and his wife have also been asked to step aside from their government roles. The decision was taken by the party's Gauteng Executive Committee last night. Newzroom Afrika's Malungelo Boy reports.
The ANC in Gauteng is satisfied with an explanation given to it by Kusela Diko, President Cyril Ramaphosa spokesperson, as well as Gauteng Health MEC Dr. Bandile Masuku and his wife Loiso, who's the MMC for Corporate Services in Johannesburg. The three were called by the provincial leaders to explain their role in a PPE scandal where Royal Baza Project was awarded the 125 million rand contract. The contract has since been cancelled. Masuku has denied any involvement in the matter, while Diko and her husband, King Matzikane Diko, say there was no corruption in the bidding and the awarding of the contract.
Was the PEC satisfied with the explanation? Yes, it was. It was satisfied that comrades have been able to clarify the issues as it relates to their involvement on the procurement process. But the PEC felt that there is a need to have a conversation on the allegations about proximity and conflict of interest.
But they must now explain themselves to the party's Integrity Committee.
And furthermore, the PEC has resolved that the Integrity Committee has to finish its work between 2 to 4 weeks. And we're putting a time frame because of our experience that it is not always easy for the PIC to conclude its reports on time. But again, what we say to government, we're saying to ourselves. We're saying to government, SIU has to operate within covert principles of agency, and therefore the ANC itself must operate within the principles of agency.
But one analyst says he is not expecting anything to come out of the Integrity Committee.
My position is that the Integrity Committee of the ANC does not have the necessary power to actually take the message forward, and that message is the message of anti-corruption.
There are currently 102 companies being probed in Gauteng for PPE procurement. For Newzroom Afrika on Channel 405, I'm Malungelo Boy in Johannesburg.
And staying with that story, I'm now joined by the Democratic Nursing Organization of South Africa's Gauteng Secretary, Bongani Mazibuko. Bongani, thank you so much for talking to us this evening. I see you're welcoming the decision by the Gauteng Premier as well to have the MEC step aside, and also, his wife also being asked to step aside. And we know that in recent days, we've also seen the presidency's spokesperson, Kusela Diko, stepping aside to allow investigations to continue.
Thank you for having me. Yes, as DENOSA, we do welcome the action taken by the Premier. We have always spoken up against corruption, and I think the Premier, the MEC being asked to step aside would also give credibility to the investigation to show that there's no interference as well. And we believe that this is the correct thing to do, so that even he, as he has done previously, where there's been investigations on other matters, members have been placed on suspension or precautionary suspension whilst they're being investigated. So let us allow the law to take its course and the investigation for the people who are guilty to be then determined by the process.
The process is now heading towards the Integrity Committee. The party is going to be probing this, and they're going to be subjected to this process in the coming days. This is the same Integrity Committee that was ignored by the ANC in the past a few times that we have seen. Do you have confidence in this process?
We do believe that under the leadership of the current president, with the current administration as well, there has been a change in tackling corruption. So we do hope that this is a first step in making sure that people are held accountable for their actions. We don't want to preempt as to what the Integrity Commission is going to do, but we are positive that this will be the first of many instances where people are actually held to account. for their actions.
And some people have been saying that while these are allegations, there does appear to be a smoking gun here. What's your take?
Obviously, there are allegations. I'd like to wait until the process is concluded and speak on facts. And I'm actually encouraged by the process because the Department of Health, if you look back, we have had a lot of instances whereby there were allegations and they were not properly investigated. And people have actually gotten away with this corruption for a long time now. So to see the Premier acting and the ANC in the province together with the SACP and COSATU actually standing together to say, let the people allow processes to take place and let us hold people who are involved in these things to be held to account. It is a step in the right direction, and we do believe that it will lead to a lot more positive things in the future.
And Bongani, just before I let you go, as a final question from me, in another matter now, some people have been coming forward. We have been speaking to some healthcare workers that have been expressing concern with, how they're not giving the right kind of PPE. Others saying that they're not working around, in conducive environments that are safe for them around this time. What are you hearing from your members, particularly as, the country has now entered the peak when it comes to COVID-19 cases?
There's a lot of anxiety on the ground currently, and you cannot blame the people because we've had instances whereby we've had complaints. As actually early in the evening, I was listening to one of my comrades from an institution in the Eastern telling me that the quality of the PPE is a concern, and we expect members to be attending to members of the public to be able to render good service. But there seems to be questions about the quality of the PPE, and then that means then that we've got a spike, as we have seen in recent weeks, of infections amongst healthcare workers, and at the top of that being nurses. I do believe that as at last week, the latest figures that we had, we've had more than 1,000 nurses testing positive for COVID-19 in this province, which is a lot. And it's a point of concern, and we need to make sure that we do everything in our power to ensure the safety of our members so that we can have continuity of service as well.
Thank you so much for your time tonight. That is Bongani Mazibuko. He is the Gauteng Provincial Secretary for DENOSA.